Welcome back, broadcasting to you live this morning from the Cape Town International Convention Centre. We're here covering the 17th World Conference on Tobacco or Health. The last time that this particular conference was held was in Abu Dhabi, and it's held every 3 years, and it's the turn now of South Africa. You know, South African government seems to be on this massive move to try and get South Africans healthy. In fact, right now, as we are broadcasting from here, I know that our president is out on a walkabout in Khayelitsha, and he's been there since 5 o'clock this morning, and lots of other South Africans are out there walking with him. And I think he's trying to put out this image of, you know, being fit, being healthy, looking after yourself, and of course being talking about cigarettes and smoking and tobacco is one of those issues that needs to come under this conversation. You and I both know when it comes to budget time, the first people to be hit in their pockets are those of drinkers and smokers with sin taxes. So we're going to see those going up, but it doesn't seem to make a difference. Smokers continue to smoke, and those numbers I've still asked you, and I'll give you the answer in the next hour here on the program. The question I'm asking you is how many cigarettes were sold globally last year, and how much revenue did this create for all of the tobacco manufacturers? That number is staggering, so yeah, try figure it out if you can. All right, let's talk to the president of the WCTOH, Dr. Flavia Senkubuge, who is our guest here on Morning Live. So lovely to have you. Welcome to Morning Live.
Thanks. Morning, Leanne. Morning to your listeners at home.
It's a great thing to have something like this here in South Africa. But firstly, why the decision? How was South Africa chosen?
We set out to have a bid. We actually had a joint bid, and this is the first time we're actually having a joint bid as two countries, South Africa and Uganda, with a number of partners, including universities like University of Cape Town, University of Pretoria. And so we went and we had a bid in Abu Dhabi, and South Africa was chosen as the country to host this conference. And the significance, Leanne, is that this is the first time in over 50 years that this conference comes to the Africa region, and so we are absolutely excited about this. Yeah.
Let's take a look at Africa, and perhaps we can pay some reference to South Africa in terms of smoking and how dire the situation is on the continent and in South Africa when it comes to the citizens and people still turning to cigarettes and smoking and losing their lives to it.
Well, in our research at the University of Pretoria, our current cutting-edge research, which we will be presenting on Friday, we have a prevalence right now of 18.2% of current smokers in South Africa. But the Africa region, although the prevalences may be low, we do know that the target is actually the young people. And so, for instance, on Monday, we held the conference of the youth conference, and the theme of this particular conference is actually uniting the world for a tobacco-free generation. And so, in as much as in Africa region we have low prevalences, the fact that it's our young people who are smoking, and now we have an uptake among women who are smoking. And so in essence, because in the Africa region we haven't got traction as yet in terms of our advocacy campaigns, they are there, but we need a little bit more impact. And then a lot of the African countries haven't ratified the global framework convention on tobacco control. Then it becomes very important for us to have this conference here in order to push our governments to ratify the convention, and also to galvanize the science to come out, because one of the things that's important is evidence-based policy making. So if you don't have local evidence, it becomes difficult. Like what you're asking me now, Leanne, what is the prevalence of country X? What is the prevalence of country Y? And there are countries in the Africa region where we are lagging behind in our science, but I can say that I think South Africa, we're doing quite well. Yeah. But
it's not about, 18% of the population, that's kind of the figures that you do have now. But it's still very high. I mean, when you think about the death rate from that, because, you know, that's a very, very big problem. But I think what we also need to look at are the laws that are constantly being updated and implemented. Are they working, though? Do you find, if you have to look over the years, I'm not sure how the comparative results are from previous years here in South Africa, when we get to the 18%, where were we sitting at since these laws started getting stricter?
Well, previously we were sitting at 22%, Leanne. Okay. So I think in as much much as somebody will argue and say, oh, but that margin is so small, we do have particularly populations, so we disaggregate our data in our various population groupings, and we do have populations where smoking has definitely gone down. In terms of the laws, South Africa was, of course, the leader in passing the law on tobacco control. In fact, we were first in the continent. We have lagged a little bit behind, but for instance, yesterday we launched the hubs, and the minister was there, and there is a new concerted effort to galvanize, laws and government input and pressure in terms of making sure that we do get some of these laws passed. For instance, the minister will be announcing that South Africa will be having plain packaging, and we are also going to strengthen our law on smoking in public places. For instance, now we have smoking and non-smoking areas, and in our research we found that, in fact, even in the non-smoking area, you still have the smoke that is at unacceptable areas.
The other issue I think that needs to be touched on. I mean, the last time you had this conference was 3 years ago, and 3 years ago, e-cigarettes they weren't as popular as they are now. Are e-cigarettes going to take a lot of the attention here as well? Because they're still, the jury seems to be out. E-cigarettes are so much better than normal cigarettes, but are they?
Yeah. No, absolutely, and this is the big thing for this particular conference, and that is why we have, and we will be presenting the cutting-edge research. We have about more than 158 countries that are gathered here in this particular conference, and so in essence, e-cigarettes have come to the fore because, of course, the marketing is that they are safer, and so as scientists, this is the one area which we are still working on, and we're calling it, so in all the sessions they're called harm reduction, and we'd absolutely invite people to come and attend those in terms of finding a global consensus of what we say in terms of harm reduction and e-cigarettes. And in our country, Leanne, we actually they need to strengthen our law because we haven't regulated them quite well. And you talk of e-cigarettes, there's also Hubbly Bubbly, which is water pipe, and that which has been marketed as safe and just a flavorant, but it isn't. And if, in addition to the risk factors and the diseases that you get from smoking, for Hubbly Bubbly, you also get any disease that you can get from droplet transmission, because of course you move the pipe from person to person.
All right, we're going to have to leave it there, but I think we're in for a very interesting couple of days. SABC are going to be covering this particular conference quite extensively, bringing you all of the guests that are going to be here. I know that Michael Bloomberg is, of course, the former mayor of New York, is going to be a guest speaker here, as well as our health minister, Dr. Aaron Motsoaledi. He'll be here this morning. Hopefully we'll have a chance to talk to him, but I know that there's a press conference that's going to kick off the entire conference that we will take live here on the program. So bring us your views. We'd love to hear from you. To smoke or not to smoke, that is the question. Is it your responsibility or is it the government's responsibility? It's always that question that I suppose grapples a lot of people. Let us take a break here on the program. News at 8 after this.